Hi, I am Matilda and I am a certified clinical aromatherapist. I'm also a trainer of internationally accredited aromatherapy courses. Because I used to suffer from hormonal imbalance, I have a keen interest in this topic. And if you like the topics that I share on this channel on empowering women in terms of health and wealth, do subscribe to this channel. And if you like this video, I'd appreciate it greatly if you could smash the like button as well. So in today's video, I'm going to share more on estrogen imbalance. So when we talk about an imbalance of estrogen, of course, there could be an excess of estrogen and there could be a shortage of estrogen in our bodies. So when the levels of estrogen in our bodies are too high, it's called estrogen dominance. And when the estrogen levels in our bodies are too low, then you are estrogen deficient. So we will be covering these two topics together in this video today. And if you like this video, do smash the like button and share it with your friends. So first off, let us understand what is the hormone estrogen about. Now, estrogen is the main sex hormone of females, although it is also present in males. In both males and females, we both have estrogen, but it is more dominant in women. And the dominant sex hormone for males will of course then be testosterone. In females, estrogen plays a very important role in our menstrual cycle as well as our reproductive system. And in men, estrogen plays a role in sexual function. Having excess estrogen can affect both males and females differently and have various impact on our health. On the other hand, we do not want to have too low levels of estrogen as well. So when we are deficient in estrogen, it will also create different chaos in our bodies. While estrogen dominance and deficiency have different signs and symptoms, there are also some common signs in terms of estrogen imbalance generally. So whether your estrogen levels are too high or your estrogen levels are too low, as long as it's imbalanced, there are some signs that we can look out for. So let us take a look at what are some of the common signs and symptoms between estrogen dominance and deficiency, and also what are some of the differences in terms of the signs and symptoms that are unique to estrogen dominance as well as estrogen deficiency. So one of the first signs of estrogen imbalance is none other than irregular periods. Okay, but it looks a little different when you are estrogen dominant versus if you are estrogen deficient. So when you are estrogen dominant, you will experience heavy bleeding and frequent periods. Whereas if you are deficient in estrogen or if you have low levels of estrogen, then you could probably experience scanty periods or you may even miss your periods altogether. Another sign of estrogen imbalance is hair loss, weight gain, low libido, fatigue, insomnia, fertility issues, and you may also experience mood swings and depression. So for those of you who have higher than usual estrogen levels, you may also be diagnosed with fibroids, endometriosis, ovarian cysts, fibrocystic breasts, cold hands and feet, and may even lead to breast cancer. And for those of you who have lower than usual levels of estrogen, you may experience osteoporosis. So why is it that low levels of estrogen actually leads to osteoporosis? That's because, right, we do need estrogen combined with calcium as well as vitamin D in order to have strong bones. So if you are missing either estrogen or calcium or vitamin D, then your bones may start to weaken, and that's when you start to have osteoporosis. We may also experience weakened teeth or maybe receding gums. And also one of the signs to differentiate between estrogen dominance and estrogen deficiency is that women who are deficient in estrogen tend to have very dry skin, like they lack moisture. So you may experience wrinkles, your skin is very dry, and even vaginal dryness, which leads to painful sexual intercourse, breast tenderness, hot flashes or night sweats, as well as headaches and migraines. So what are some of the causes of estrogen dominance? How does it actually come about? If we do not detox regularly and there are too much toxins in the liver and we do not have optimal gut health, Maybe we have a deficiency of digestive enzymes. We are not able to digest our food properly, or we have low stomach acid, low magnesium levels, dehydration, insufficient fiber, and hence we're unable to move our bowels frequently. We're not able to detox our system, and the excess estrogen then gets recirculated in our system, and that's what causes the excess levels of estrogen. Another reason is toxin exposure. Every day, the containers and the plastic bags that we use to keep our foods in, our drinks in, especially if the food or the drinks are hot, that may cause the plastic toxins to leach into what we are actually eating every day. And so that's one source of toxin exposure. Toxic chemicals found in our personal care products like our shampoo, our bath gel, our facial wash. So that's why I have been using chemical-free personal care products for the last 8 or 10 years. Even our household cleaning products, it's best if we can get those that are chemical free, or we can actually create our own products made of natural ingredients. Another source of toxins could be from glyphosate. So glyphosate is a kind of herbicide, and it's commonly found in processed food as well. And of course, the common denominator for hormonal imbalance and in many modern day diseases will be stress. When our stress levels rise, it actually creates a lot of havoc in our bodies, and as well as our hormones. So we want to keep that in check. Personally, aromatherapy works very well for me in terms of reducing stress levels, just by diffusing the oils when I sleep and inhaling them whenever I feel stressed. Another cause for estrogen dominance will be having excess fat in our body. So it is important that we do moderate exercises to reduce the level of fat and increase our muscle mass. However, you may also wish to know that while moderate exercises is good, we should not over-exercise, because by over-exercising, it might also create an imbalance in our hormones, and that might lead to lower than desired levels of estrogen instead. Now that we have understood what are some of the causes for estrogen dominance, let us understand what are some of the causes for low levels of estrogen. Now, usually the cause for low levels of estrogen is because of aging. Now, as we age and as we move towards the menopause age, our levels of progesterone, estrogen, testosterone, all these hormone levels actually start to drop quite drastically. So that's why one of the symptoms for menopause is also hot flashes and night sweats, headaches, migraines, which are some of the symptoms of low estrogen levels as well. However, if the cause is not due to age, it could be due to over-exercising, as I had mentioned earlier. It could also be due to eating disorders like anorexia, or it could be extreme dieting. And some of the common causes for low levels of estrogen as well as high levels of estrogen could also be due to exposure to toxins, stress levels, or it could be due to some chronic issues like ovarian cysts, chronic kidney disorder, pituitary gland problems, autoimmune condition, or genetic defects. So what are some of the foods, herbs, supplements, or essential oils that we can actually use for estrogen imbalance? If you want to decrease your levels of estrogen because you are estrogen dominant, then you probably want to take a fiber-rich plant-based diet that is filled with cruciferous vegetables like broccoli, cauliflower, kale, cabbage, as well as mushrooms, red grapes, flax seeds, whole grains. And it will be best for you to avoid genetically modified soy, conventional meat and dairy, processed food, sweets, and refined grains. And if you are deficient in estrogen, you will want to take more of phytoestrogen-rich foods. And some of these foods are non-genetically modified soybeans, flax seeds, sesame seeds, and you might also want to supplement with vitamin D. Whether you are estrogen dominant or estrogen deficient, you can also supplement with vitamin B complex that helps to reduce stress. And you can also supplement with vitamin D because vitamin D is very beneficial for balancing our hormones. For herbs, you can use Vitex, or what we commonly known as chasteberry, as well as Angelica, or what we know in Chinese as Dang Gui. So for Angelica, you can also find it in the form of essential oils. But however, if you want to take it in the form of essential oils, you do have to make sure that it is of therapeutic grade so that you can experience the full benefits of the Angelica essential oil, which is highly concentrated and very powerful. For general balancing of your overall estrogen levels, besides Angelica essential oil, you can also try out clary sage, fennel, and sage. So these essential oils are smart enough to help balance our overall estrogen levels, along with the dietary and lifestyle changes that I have suggested earlier. If you'd like to find out more about the properties of each individual essential oil, do leave me a comment below and I will respond to you. And if you'd like to really bring your knowledge in terms of aromatherapy to another level, you can check out my aromatherapy courses down in the link that's listed in the description below. So if you like this video, I greatly appreciate if you could smash the like button and share it with your friends. And if you haven't watched my previous video on low levels of progesterone, do check out the link over here. Do subscribe to this channel and hit the notification bell so that you will be notified of future videos.